Namaste everyone. Warm welcome from the Pediatrics and Neonatology Department of Rashtrotthana Hospitals. I am Dr. Savanai, one of the consultant pediatrician and neonatologist. Today in this talk, I would be covering about the services available in our hospital, especially pediatrics and neonatology. And in briefly, I will be talking about what are the causes and prevention of recurrent fever in children, and also what the children need to wear during the winter season. First, coming to the pediatric and neonatology services, in our hospital we have emergencies, OPDs, NICU and PICU services. There is emergency services 24/7 round the clock, adequately supported by the nursing staff, and 24/7 consultant services. OPDs are available round the clock, and also we have all the pediatric specialties including pediatric surgery under one roof. In the NICU, we have a very qualified, very equipped and level 3 neonatal tertiary center which caters to the population of around 8-bedded NICU, adequately trained nursing staff, and 2 qualified neonatal consultants, myself Dr. Savinay and Dr. Nivedita. We will be taking care of babies including extreme preterm babies from 26 week onwards and any sick newborn baby who is admitted in the NICU. We have 2 ventilator setups at our disposal. Till now we have successfully managed 2 preterm babies, one a 33 weeker who was on respiratory support CPAP, and other a 33 weeker who weighed just 1.49 kgs who was successfully treated and went home. Both these babies were treated successfully, and they were on EBM, express breast milk feeds, and no formula feeds were given, and kangaroo mother care was practiced in both of these babies. We also have excellent PICU services managed by Dr. Vishwanath, PICU consultant, and we have a ventilator at our disposal, and we are capable of managing pediatric emergencies and PICUs. And there are few cases admitted in the PICU like dengue fever and also respiratory emergencies, and with a successful outcome. Now coming to the main agenda of the topic today, like what are the causes for the recurrent fever in children. This is one of the very common questions that parents bring the children to the hospital and the OPDs. They will come with the questions like, my children is suffering from recurrent fever, they are having fever every month, what should I do? First, let me assure you that they having an episode of 7 to 10 episodes of fever in a year is quite normal. Nothing to worry about it. Only when it becomes very frequent, more than 12 episodes in a year, or the episodes are more in duration, or the child is very sick, then you have to be worried. Otherwise, 7 to 10 episodes in a year is quite normal. And fever as such, we shouldn't be more alarmed. Fever is a natural defense mechanism to fight any infection, and a little bit of fever is quite beneficial. Say up to 99 to 100 fever, the child is playful and active, passing adequate amounts of urine, not lethargic. Nothing to worry about it, don't worry. Only when it's more frequent, then it should be bothered. Most causes of fever in children are due to viral infections, and like a viral upper respiratory tract infection, a ear infection, a throat infection, and most of the times 90% of them are due to viral infections. Some of the infections can be due to bacterial infections like a ear infection or stomach infection, but and very rarely do you come across other infections like tuberculosis and primary immunodeficiencies, like the immunity of the child is really a concern. Primary immunodeficiency, very rare causes of recurrent fevers are due to these causes. So what I should do is, whenever a child comes with fever, don't do unnecessary investigations, and no need for unnecessary antibiotics. The more antibiotics we give, there are some good bacteria and bad bacteria in our stomach. When we give the antibiotics unnecessarily, the good bacteria are killed in our stomach and the bad bacteria grow, and they are prone for recurrent infections again and again. The more antibiotics we give, the more the harm it does to the baby rather than doing any good. So avoid unnecessary antibiotics. Next, Suppose a child comes with fever, what are the first things that a mother or a child, or mother or a parent should do? Whenever a child has fever, don't panic. Just do a tepid sponging. What is the tepid sponging? Dip a cloth in warm water and wipe the whole body. Maybe you have to do every hour till the temperature comes down. This brings down the temperature fast. If the temperature is above 100 or 101, give some antipyretics like fever reducing medicines like paracetamol or ibugesic, and most of the times the fever that is there, and also very important that you hydrate the child very well. Give them lot of fluids, lot of rest, and keep the clothings really thin, and don't use excessive sweaters and excessive blankets that can increase the temperature of the baby. Use thin clothing, adequate hydration, good rest, and tepid sponging. These are the simple things that can make the child feel better, and most of the time the temperature comes down in 3 to 7 days, because most of the causes of fever are due to viral fever, which comes down in a day or in 3 or 7 days. Only when it persists more than 7 days, then you should be a cause of bother and really need to be worried. Now coming to the other preventive aspects of how to prevent fever in children. I will go age wise as to what are the healthy lifestyle habits that needs to be done to prevent such occurrence of recurrent fever. Coming to the most important thing, vaccinate your child according to the immunization schedule. If you vaccinate the child, there are some bacteria or organisms which are the causes for some serious and recurrent fevers in children, like pneumococcal, H influenza. If you vaccinate the child with these vaccines according to the schedule, you are preventing most of the causes of fever in children. So vaccinate the child according to the immunization schedule. Now coming to less than 6-month-old child, how do you build up the immunity? How do you make the child strong? Very important. Less than 6 months, give exclusive breastfeeding. Breastfeeding has all the immunity building powers and nutrients in them. So less than 6 months, don't give formula feed, don't give bottle feeding. Just exclusive breastfeeding is enough for the child, and vaccinate according to the schedule. Now coming to the next age group, 6 to 12 months. This is the period of weaning. What is weaning? Weaning is we take the child away from breast milk and start off with the solid diet in the child. What do the parents do? They start the child on some artificial like Cerelac and all those things. Don't do that. Prepare homemade weaning food like rice kanji, potato soup, tomato soup, smashed potatoes, smashed vegetables, smashed carrots. All these things, they are very good for the nutrition and immunity building power of the child. And the constitution and how should the consistency of the weaning diet should be? It should be like a thin paste, not like water that when you tilt it, it comes out like water. It should be like a thin paste sticking to the vessel. So all weaning food is very important to build up the child's immunity. Give a homemade food like ragi sari, rice ganji. All these things are good for a weaning diet. Now coming to the 1 to 5-year-old, very important phase of the child. During this phase, children should be given fruit juices, homemade fruit juices, very important, homemade fruit juices, and avoid junk food, avoid chips, Pepsi, Coke. All these things will naturally dampen the immunity, and child is prone for recurrent infection. Give homemade food, homemade fruit juices. And suppose the child wants some junk food like a pizza, what should we do? So if in a week, give 1 day of junk food like a pizza. Rest of the days, make homemade food which is as tasty and as delicious as outside food. In this way, you are taking care of the appetite of the child and also giving a nutritious diet. And what are the other important things to build up the immunity and to fight the recurrent fever is, we should set an example. The parents are the ones who set up an example for the child. So suppose the child is not doing exercise regularly. That means the parents are not doing also the exercises regularly. Parents should get up in the morning, do walking morning and evening 1 hour a day, eat healthy food. So in this way, they are setting up an example for the child to follow healthy habits. And 1 hour a day of exercise is very essential. 2 things will happen in this way. One, the child's health will improve, and also we are preventing the child from getting obese. And suppose you tell a child eat fresh and healthy diet, that will not work. The parent should set an example to follow the healthy diet at home, and then the child will also follow the healthy diet and be healthy. And what is most important thing is, apart from the physical health, the mental and the spiritual health is also very important. Take a child out every day to a garden or a zoo, so that they can know, they can mix with other people and also have recreation in the zoo. So in this way their mental health and spiritual health will also improve. So these are the common things which we can do to prevent recurrent fever in children. Now coming to the other important thing, suppose the child is getting recurrent infections which is there for a long period of time, say 7 to 10 days, and the fever is very high grade, 102, 103, the child is very lethargic, not very active, not drinking well. These are the causes that we are more worried. Then you might have to take the child to a doctor, do some investigations, and maybe if the infections is very high, maybe a bacterial infection, then treat the child with antibiotics. And if the child is getting recurrent bacterial infections, like recurrent chest infections, recurrent ear infections every month, then these are the signs that you are really worried about. This could be a sign of from primary immunodeficiency in children, and then the child needs to be meticulously evaluated and treatment under the care of a specialist immunologist. Otherwise, most of the causes are viral fevers. Follow basic measures to bring down the fever, follow healthy lifestyle, healthy diet, healthy exercise, vaccinate the child properly. You are taken care of most of the child. And very important, some of the most preventive aspects of recurrent fever is we are not hand washing. To make sure that we do hand washing with soap and water regularly. Whenever you go to a toilet, whenever you come out from playground, do hand washing regularly. And whenever a child has a fever, make sure he wears a mask. Get a flu shot, very important. Children in this season are prone for flu infections. Get a flu shot, and make sure that the child follows healthy lifestyle practices. So all these things will take care of the fever again. Now I will talk to you in brief about what are the preventive aspects and what clothing should the child wear during the winter season. During the winter season is a season when the child needs to be wearing proper clothes. Suppose it's a newborn baby, put on the cap, put on the masks, put on the mittens. All these things will keep the baby warm. Suppose it's a toddler, put on the gloves, put on the cap, put on the socks, and make sure that they don't put on heavy sweaters. Very important. If you put on heavy sweaters, then they can be very uncomfortable and it will not help much. Light clothing but adequately covered. Woolen cloths and woolen and cotton cloths are preferred. So all these things will make the child comfortable, and you can take care of the winter very easily. So and I'd like to thank the management for giving me an opportunity to talk on these topics and the excellent support they have given. Thank you. Thanks everyone.
ರಾಷ್ಟ್ರೋತ್ಥಾನ ಆಸ್ಪತ್ರೆಯು 160 ಹಾಸಿಗೆಗಳ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಯ ಮಲ್ಟಿ ಸ್ಪೆಷಾಲಿಟಿ ಹಾಸ್ಪಿಟಲ್. ಅಂದರೆ ಒಂದೇ ಸೂರಿನಡಿ ಆಧುನಿಕ ವೈದ್ಯಕೀಯ ಪದ್ಧತಿ, ಆಯುರ್ವೇದ, ಹೋಮಿಯೋಪತಿ, ಯೋಗ ಮತ್ತು ಪ್ರಕೃತಿ ಚಿಕಿತ್ಸೆಗಳನ್ನೊಳಗೊಂಡ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಗಳು ಇಲ್ಲಿ ಲಭ್ಯವಿವೆ. ಅತ್ಯಾಧುನಿಕ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ, ಉತ್ತಮ ತಂತ್ರಜ್ಞಾನ, ತಜ್ಞ ವೈದ್ಯರು ಹಾಗೂ ಇತರ ವೈದ್ಯಕೀಯ ಸಿಬ್ಬಂದಿಗಳನ್ನು ಈ ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. 19 ಜನರಲ್ ವಾರ್ಡ್ಗಳು, 72 ಸೆಮಿ ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳು, 11 ಎಮರ್ಜೆನ್ಸಿ ವಾರ್ಡ್ಗಳು ಹಾಗೂ 17 ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳಿಂದ ಕೂಡಿದ ಸಮಗ್ರ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ ಇಲ್ಲಿ ಲಭ್ಯವಿದೆ. ಮುಂದಿನ ದಿನಗಳಲ್ಲಿ ಬಡ ರೋಗಿಗಳ ಬೆಂಬಲಕ್ಕಾಗಿ ದಾನಿಗಳ ಸಹಾಯದಿಂದ ನಿಧಿಯೊಂದನ್ನು ಸ್ಥಾಪಿಸುವ ಗುರಿಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಜೊತೆಗೆ ಹತ್ತಿರದ ಸ್ಲಂಗಳಿಗೆ ಹಾಗೂ ಹಳ್ಳಿಗಳಿಗೆ ಹೋಗಿ ಉಚಿತ ಆರೋಗ್ಯ ಸೇವೆ ನೀಡುವ ಯೋಜನೆಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಆರೋಗ್ಯ ಸೇವೆಯನ್ನು ಅರಸಿ ಬಂದವರಿಗೆ ಮಾನವೀಯ ಮೌಲ್ಯಗಳೊಂದಿಗೆ ಆರೈಕೆ ನೀಡುವುದು ಮತ್ತು ಉತ್ಕೃಷ್ಟ ಗುಣಮಟ್ಟದ ಚಿಕಿತ್ಸೆ ನೀಡುವುದು ಆಸ್ಪತ್ರೆಯ ಆಶಯ. ಎಲ್ಲರೂ ರೋಗಗಳಿಂದ ಮುಕ್ತವಾಗಿ ಆರೋಗ್ಯವಂತ ಸಮಾಜ ನಿರ್ಮಾಣವಾಗಲಿ ಎನ್ನುವುದು ಆಸ್ಪತ್ರೆಯ ಉನ್ನತ ದೃಷ್ಟಿಕೋನ.